I'm Steve Ballmer, founder of USAFacts. USAFacts is a nonpartisan, not-for-profit civic initiative providing a numbers-driven portrait of our nation. Let's get to the facts. How are we doing on healthcare? Well, the amount of money that's being spent on healthcare, and this is all the money being spent, not just the money being spent by government, but government also gives incentives to employers to provide healthcare by making that a tax-deductible expense for the employee. Government has engaged in the actions to subsidize healthcare. But what we see in healthcare overall is a rise to $3 trillion. Now, that's not all government spend, but that is a significant piece, 15% or so about, of our nation's total economy, being spent on hospitals and physicians. The numbers have grown fairly dramatically over the years, 359%. Again, inflation adjusted since 1980. If you look at those numbers on a per person basis, those numbers are also up quite dramatically, over 220% over the time frame since our population has grown. What are we getting as a result of all of the increased spend by government and is encouraged through government incentives? One or two different ways to look at that would be to start with life expectancy. For a child born today, how long can they expect to live? Over the period since 1999, that's gone from 76.7 years to 78.6, but has declined slightly in the last several years, which means a child born today can expect to live less long than a child actually born a few years ago. That's an interesting fact. Are we buying better outcomes for our healthcare? But this is a case in which we're presenting a government estimate of the future, how long somebody might live. The thing that we know accurately is the average age at which people are dying, which has gone from 72.4 years to 73.1 years. We are living about 9 months longer from that fairly large, as you could see earlier, increase in healthcare spend. Maybe that money goes into the last year of someone's life, maybe not. We're generating those numbers from what the government provides today, but it's a lot of additional spend, 9 months of additional life. Some of the situational factors that go into health are partly a result of government action, but also personal actions. For example, the obesity rate has grown steadily since 1999 and now stands at 32%. And there are health consequences of this kind of a change. In the context of health, one of the things that's most in the newspaper and people discuss is what's going on with opioids and drug epidemics. We can see that the deaths from drug overdose has risen steeply, actually, in the last few years to over 70,000 deaths. To put this in context, though, about 2.8 million people die every year in the U.S., so it's still very, very small percentage of the total people who die. Doesn't even show up, for example, in the top 10 causes of death. But most people, many people would say, these are avoidable deaths. If you take a look, the opioid number is certainly up, remembering, of course, that opioids also includes heroin, in addition to the new forms of opioids coming to market. But the rise in deaths from cocaine and from meth are actually on a higher trajectory, higher percent increases now than the deaths from opioids. Certainly all an important discussion and debate and set of areas in which government can focus policy. Visit USAFacts.org to explore, to get the facts, and decide for yourself.